I think some of the highlights of our residency program is really the faculty to resident ratio. I think we have an excellent faculty to resident ratio. The faculty's doors are always open. They have really good pedigrees too. I mean, Dr. Arshad trained at Duke, Dr. Balfour trained at UT Houston. I think we have very well-trained psychiatrists who are really invested in teaching. I think the other part of this program is truly also the location, right? You're only an hour away from Chicago. So on the weekends when you really want to go hang out or have fun, the city and all that it has to offer is really close by.
So residents get exposure to a very diverse patient population, diverse set of cultural backgrounds, and that really helps them understand where patients are coming from, meet them where they are, and provide compassionate care.
We treat everything under the sun as far as psychiatric disorders are concerned. We will treat your bread and butter depression to some of the rarest of rare cases to psychotic disorders. We also treat children who have autism, elderly patients who have dementia with agitation, personality disorders. We have the entire DSM textbook actually at our hospital.
The continuum, we have the inpatient units. We have 3 child adolescent units, 1 acute adult unit, and a geriatric unit. As well as I said, the consultation liaison piece on the medical floors. After the acute level of care, we have a partial program, both intensive outpatient treatment and partial hospitalization program available, both in terms of a step down from the hospital as well as a medium to prevent hospitalization. The IOP program primarily focuses on mental health issues. The PHP program is a dual diagnosis focusing on chemical dependency plus mental health issues.
People say it's a small city, but it's not. It's actually, has a lot more options in terms of treatment, and Riverside actually provides a wide variety of psychiatry resources and opportunities for patients here.
Well, one thing that I think is really great about Riverside is that it values wellness, and so Riverside values wellness among its residents in that they incorporate it throughout the training program. So we have a resident-led wellness committee that sponsors different events and activities for residents to kind of de-stress and bond and get to know each other. And then I also lead a process support group for the residents.
In this residency, we do offer a very collegial environment. So that means that there's a lot of collaboration between residents, in terms of residents to residents peers within psychiatry and also with the different medical specialties, because especially in the first year, they are going to rotate through medicine, neurology, and other specialties. So they start to build those relationships, which they carry forward through their time here in the residency, because when they come back into core psychiatry, they are going to do consult and liaison psychiatry, in which they're still going to have contact with their other colleagues.
Residents are training in a place like this. We also focus on evidence-based practices. And I think that is really important, that they learn tools and ways that they can really supplement their education in a way that is evidence-based.
The important thing is seeing the wide variety of patient population here and the amount of experience that we gained even during our learning practice.
Well, I think that we have a lot of great minds and teachers through our attendings, and I also think that it provides a lot of room for leadership opportunities to shape the program and make it what you want it to be.
I think the most important thing that I want to focus on is the curiosity to keep learning. I think that's extremely important. I think that psychiatry is an ever-evolving, ever-changing field, and I think that as the society and the social pressures mount, like social media and other aspects, we have to keep adapting. And I think being curious is the most important way to keep learning. And I think that even curiosity takes you a long way, but focusing on hard work, persistence, and I think that even finding time for yourself, because things can be very tough in a residency program. Sometimes you can feel overwhelmed, sometimes there's a lot of pressure, sometimes you're managing multiple things at the same time, so you have to build resilience. So I think that a combination of curiosity, hard work, and resilience are the main values I would like our residents to have.